Europe following immunization with AstraZeneca. The reports that we're getting is that that particular batch that there's been a concern about did not come here to Canada. Health Canada is saying at this time there is no indication that the vaccine caused the events. To date, no adverse events related to AstraZeneca have been reported to Health Canada. So not thought to be a concern here in Canada. It's still full steam ahead when it comes to AstraZeneca, although understandably, folks asking questions about those reports, perhaps taking a little bit of a pause to inform themselves, but officials in this country saying not to worry, it is still in your best interest to take this vaccine.
I wonder though what that does. David, when you have that conversation about that, even though Health Canada is giving very reassuring comments, and then you've got the conversation around people over 65, which is we know NACI, the Immunization Committee, is looking at right now to see whether that advice will be changed. I'll get you both to weigh in on that, but David, why don't you start?
Yeah, I mean, AstraZeneca has had a bit of a marketing challenge since it's been launched, right? Starting with the lower efficacy rate, and now these concerns over blood clots, whether it's linked back to a specific batch or not, we'll see where the investigation goes. But like Britain has done millions of people with AstraZeneca, and if you look at blood clots and other complications, they are statistically in line with these outcomes in the broader population during normal times. So, you always want to assess these things and make sure they're okay. But, the data would suggest, and there is no clear causal link or even, an implied causal link. So it's possible the investigation could clear this up. And just to sort of backstop what Catherine was saying, there is technically no AstraZeneca in Canada. What we have is Covishield, which is the Serum Institute version of the AstraZeneca vaccine. So it's their version of the same recipe made in a different facility. So while this may be a concern in Europe, it's not necessarily an immediate existing concern in Canada. The more immediate existing concern in Canada about AstraZeneca is when can we expect the supplies to come here. If you look at the latest news, AstraZeneca telling the European Union it's going to miss its targets from April to June by more than half, it looks like. Reports out of the U.S. has the Biden administration sort of stockpiling tens of millions of doses of AstraZeneca, even though the vaccine is not yet approved for use in the United States. Those are the two main areas where we're going to get our supply from in this country, and if the European demand isn't being met and the U.S. isn't letting it out of the country, that makes it practically impossible for Canada to get doses in the short term unless something radically changes in both of those jurisdictions and an exception is carved out for the Canadian supply.
We did receive some from that Covishield program this week, if I'm not mistaken, Catherine.
That was from India, though, right?
Oh, that was from India. Yeah. But the generic version of it, sorry. Catherine.
Yeah, and this is where we're seeing this difference, I guess, between various jurisdictions in the country in terms of how they choose to use those doses. Right here in Ontario, for instance, because of some of this debate about the recommendations from Health Canada versus the National Immunization Advisory Committee. Here in Ontario, for instance, people between the ages of 60 and 64 are able to get it, although it's a little bit of a complicated rollout where they're doing essentially pilot projects at pharmacies in particular jurisdictions. There are other places that have just gone ahead and said, listen, we need to get folks vaccinated as quickly as possible. The data, the real world data, because this is part of where the concern is here, right? The National Advisory Committee on Immunization looking very much at the study data. But we know, as David said, the wide use of AstraZeneca, for instance, in the United Kingdom, suggesting that it is effective, the real world data in these much larger groups of people, because when you're talking about a study of a vaccine, you're talking about what, 45,000 people, still a significant chunk, enough to give scientists the information they need to decide whether or not to approve it, but much greater swaths of the population now. And some jurisdictions looking at that data and saying, no, that's enough for us. We feel that we should be able to use it for people. It does, though, all speak to the very complex situation that we're looking at right now in Canada. Concerns about what is the future of AstraZeneca doses, as David points to. We know that just earlier this week when we heard from the Prime Minister, he did signal that those Johnson & Johnson doses, there are concerns about those showing up on time. Similar production concerns, European markets saying that they're not sure they're going to be able to get the kinds of doses they need. At the same time, what's happening right now in Canada is actually a major ramp up, right? We are looking at jurisdictions trying to deal with the amount of vaccines that they're getting and the challenges of getting that in people's arms. I think we're seeing perhaps sort of an uneven rollout of that across the country, as we might expect. For instance, right now in Quebec, in Montreal, if you are 65 and up, you can go get a shot right here in Ottawa. Today, they're announcing that people who are 90 years old and up can get it anywhere within the city. They're opening things up. So things happening at different paces, but the broader message at this moment is that we're about to see a major increase.
Yeah, and provinces we've seen, as you rightly point out, Catherine, sort of struggling with the systems they have or don't have in place. BC, of course, was the one this week, which was overwhelmed even with phone lines and doesn't even have an online booking system yet. So yeah, very different situation. I will say though, and because we're all in the same meetings, anecdotally, it sounds like more people are getting appointments. Just it seems like every day more and more colleagues are booking appointments for their parents or grandparents. So something's working, whether it's happening quickly or not, I'm not sure. Oh, look, he's on time. That's a joy. That's a joy for this Friday. All right, we'll come and talk to you after the Prime Minister. And here now, the Prime Minister of Canada on this Friday morning.
Bonjour à tous. Hello, everyone. Yesterday, we marked 1 year since the pandemic officially began. No matter who you are, getting through the last 12 months has taken strength. It has taken courage. But above all, it has taken hope. There are still many days to go in this pandemic, but each one that passes, just like each person who gets a vaccine, brings us closer to the better days ahead. À ce jour, on a
To date, we have delivered more than 3.8 million doses of COVID-19 vaccine to provinces and territories. We'll be receiving a million more doses by the end of the month. And as of April, we'll begin to receive even more rapidly. This week, Major General Fortin's team at the National Operations Centre conducted a rehearsal exercise with partners from the industry, as well as federal, provincial, territorial, and Indigenous partners. This rehearsal served to determine that we are ready for the fast-track delivery phase. All resources are being devoted to this. Last night, we had our 28th First Ministers meeting. We issued a joint declaration to highlight the one-year anniversary of the heroes who are working on the front line in the health field. We recognized families that had lost loved ones, and we emphasized the importance of continuing to work together, to being there as a team. Canadians all across the country. We will continue to do so, and we will continue to be here for you.
Based on new delivery schedules from Pfizer, I can confirm that Canada will receive at least 1 million Pfizer doses per week from March 22nd to May 10th. 1 million doses of Pfizer alone every 7 days. That's going to make a big difference. We have shared these updated delivery schedules with the provinces and territories. This is so they can continue to plan for mass vaccination sites to get you and your family protected as soon as possible. Every dose makes a difference. Last week, Susan from DDO in Montreal wrote to me to say that she and her husband, who are both seniors, had gotten their first dose. She told me about the relief they felt after a year of worrying. Susan, je suis content de savoir que vous et votre mari soyez enfin plus en sécurité.
Susan, I'm happy to hear that you and your husband now feel safe. As I've mentioned before, anyone who wishes to be vaccinated will be able to do so before the end of September. One of the best ways to protect yourself against the virus is to be vaccinated. And if you have already become vaccinated, it's important to remember to continue to do your part to ensure that others remain safe. Winter has been long, and we're all impatiently waiting for spring. As Canadians, with our wide open spaces, we like to spend time outdoors. This past year, especially after days of Zoom meetings, a lot of people rediscovered how wonderful it is to go for a walk outside or to take the kids for a bike ride on the weekend. It's important to be able to get out and walk or move around. That's why, over the last 5 years, we've made investments across the country in projects such as Kelly's Brook Path in St. John's, Newfoundland, and Grouse Mountain Trail in Vancouver. These projects are not just designed to make hiking paths or wheelchair-accessible paths up to bus stops rather, they allow everyone to get out and get moving, and they help us build stronger, healthier communities. In this respect, we're entering a new phase today.
As Minister McKenna announced earlier this morning, we are investing $400 million for bike lanes, trails, and pedestrian bridges across the country. This is part of our historic public transit investment over the next 8 years and our plan to create 1 million jobs. This will lead to stronger communities, clean air, and new jobs. And that's a win-win. And that's our blueprint to come roaring back from this pandemic. As we rebuild from this crisis, it's up to us to create the kind of Canada we all want to see, a country where everyone has what they need to succeed. Right now, one of our top priorities is ensuring that no one misses out on vaccines. This includes Indigenous communities, which are particularly vulnerable to the virus. Vaccination is underway in over 530 Indigenous communities and communities in the territories. And for Indigenous people living in cities, we're working with the provinces and territories to get everyone their shots as soon as possible. Of course, keeping people safe and ensuring communities have the resources they need doesn't end with vaccines. And on that front, this morning, I want to talk about where we are with long-term drinking water advisories. Earlier this week, we marked an important milestone in our partnership with First Nations communities, the lifting of the 101st long-term drinking water advisory since we took office. Thousands of homes now have clean water. That's real progress, but I know that there is more work to do. As Minister Miller has said, we will not stop until everyone in every community has access to clean water. Finally, I want to end this morning on the news that the Canadian economy gained 259,000 jobs, both part-time and full-time, in February. For the workers who are back on the job and for their families, this is the good news they need. Every step of the way, our focus has been on supporting Canadians through the storm. But let's not forget there are still far too many people for whom things continue to be really tough. If that's you, know that you're not alone in this crisis. We're here to help you get through it and get back on your feet. That's exactly why we are extending the Canada Emergency Wage Subsidy and the Canada Emergency Rent Subsidy and Lockdown Support at their current levels until June, as I announced earlier this month. For places like the Hamilton Conservatory for the Arts, the wage subsidy has been the difference between having to shut down or keeping people on the payroll. And it's the same story for millions of workers right across the country. Quand on a créé la PCU en mars dernier,
When we created the CERB last March, I remember telling you that we would give you the support you need when you needed it. And that hasn't changed. That will never change. Together, we're going to get through this. Thank you, and I'll now give Dr. Tam the floor.
Bonjour à toutes et à tous. Today, we'll start with a numbers update, closing out a week of remembrance with renewed commitment to the efforts that will shape our future. Today, there have been 899,757 cases of COVID-19, including 22,371 deaths and over 30,670 currently active cases reported across Canada. And over the past week, an average of over 3,050 new cases and 31 deaths were reported daily. At the same time, over 2,050 people with COVID-19 were being treated in our hospitals each day, including about 540 in critical care. To date, close to 3,000 variants of concern cases have been reported across Canada, with the B117 variant accounting for over 90% of these to date. During the past year, and in the lead up to yesterday's National Day of Observance, I received many notes from Canadians sharing their reflections on the year that was, including the heartbreaks and the lessons that were revealed along the way. to all those who have lost loved ones during a year when we could not ease their passing or memorialize their lives as we would have, I extend my deepest sympathies. Though difficult times have passed without them, the day will come when we can gather again with friends and family to honor their memory and celebrate their lives. As vaccine programs continue to escalate, more than 2.7 million doses of vaccines have been administered across Canada. Over the past week, provinces and territories have administered close to 600,000 doses of COVID-19 vaccines, which is the highest number of vaccines administered in a single week since vaccination began in mid-December. We are making progress every day, and as the snow melts and the first day of spring is just over a week away, I know that we're all anxious for the finish line on this long marathon. But right now, racing towards the finish could cost us the success we've worked so long and hard for. Right now, we need to run the mile we are in and keep to a steady, cautious pace. Let's all continue to support Team Vaccine by not providing any opportunities for Team Variant to gain more ground. Before I close, I would like to say a special word of thanks to incredible public health workforce in this country and around the world. Dedicated people, too numerous to count, have and will continue to work tirelessly behind the scenes, not just since COVID-19 was declared a pandemic, but in the lead up, during, and long after. From those who test and trace at the local level, to those who bring us the latest numbers and pore over emerging evidence that shapes and adapts our guidance across every area of the response, thank you. This is truly the largest, most complex response in the history of public health, and the public health workforce in Canada has been dedicated to giving their best efforts every day. On behalf of all these quiet heroes, I dedicate my closing public health message. Please remain vigilant, follow public health advice, and keep up with individual practices that protect us and our families. It is up to you plus public health. Thank you.
Bonjour à toutes et à tous.
Hello, everyone. We'll start today with the latest numbers, closing out a week of remembrance with renewed commitment to the efforts that will shape our future. To date, there have been 757,000 cases of COVID-19, including 22,371 deaths and over 30,670 currently active cases reported across Canada. Over the past week, an average of over 3,050 new cases and 31 deaths were reported daily. At the same time, over 2,050 people with COVID-19 were being treated in our hospitals each day, including about 540 in critical care. To date, close to 3,000 variant of concern cases have been reported across Canada, with the B117 variant accounting for over 90% of these to date. During the past year, and in the lead-up to yesterday's National Day of Observance, we have received many notes from Canadians sharing their reflections on the year that was, including the heartbreaks and the lessons that were revealed along the way. To all those who have lost loved ones during a year when we could not ease their passing or memorialize their lives as we would have, I extend my deepest sympathies. Though difficult times have passed without them, the day will come when we can gather again with friends and families to honor and celebrate their lives. As vaccine programs continue to escalate, more than 2.7 million doses of COVID-19 vaccines have been administered across Canada, Over the past week, provinces and territories have administered close to 600,000 doses of COVID-19 vaccines, which is the highest number of vaccines administered in a single week since vaccination began in mid-December. We are making progress every day, and as the snow melts and the first day of spring is just over a week away, we know we are all anxious for the finish line on this long marathon. But right now, racing towards the finish could cost us the success we've worked so long and hard for. Right now, we need to run the mile we are in and keep to a steady, cautious pace. Let's all continue to support Team Vaccine by not providing any opportunities for Team Variant to gain more ground. Before concluding, we would like to say a special word of thanks to the incredible public health workforce in this country and around the world. Dedicated people, too numerous to count, have and will continue to work tirelessly behind the scenes, not just since COVID-19 was declared a pandemic, but in the lead-up, during, and long after. From those who test and trace at the local level, to those who bring us the latest numbers and pore over emerging evidence that shapes and adapts our guidance across every area of the response. Thank you. This is truly the largest, most complex response in the history of public health, and the public health workforce in Canada has been dedicated to giving their best efforts every day. On behalf of all these quiet heroes, we dedicate our closing public health message. Please remain vigilant, follow public health advice, and keep up with individual practices that protect us and our families. It's up to you, plus public health. Thank you. Thank you, Dr. New. We'll start the question period, the 20-minute question period with the Prime Minister. You can have one question and one follow-up question. The ministers will be available for another 20 minutes.
Today, for 20 minute, one question, one follow-up. The ministers and doctors will remain available afterwards for another 20 minutes. Starting with the phone, en commençant par le téléphone. Opérateur, c'est à vous.
Thank you. Merci. For questions on the telephones, please press *1 on your device's keypad. Pour toute question au téléphone, faites *1 sur votre appareil. La première question, Marie Vastel, Le Devoir.
First question, Marie Vastel, Le Devoir newspaper. Hello, Mr. Trudeau. I'd like to come back to what you said this morning on CTV, the idea of a vaccine passport. You seem to distinguish between an international vaccine passport and one that would require it for certain domestic activities, if I can say this. You talked about the question of charter rights. Is that the problem? And are you excluding the idea of a vaccine passport domestically? Answer, I'm not excluding anything, Marie. We'll see how the next months unfold. First, we need to ensure that we get back to normal, and also, we need to protect Canadians as much as possible. But we can clearly see that there are two issues with regard to vaccine proof or certificates. One is that we would need vaccination proof to travel internationally. Now, that's something that's existed for a long time. When you travel to certain countries, you need to demonstrate that you've been vaccinated against certain diseases, tropical diseases, for example. Otherwise, you'll be refused entry. So this is a well-established practice, and it's something that countries are actively exploring, and we're among those countries. Now, when it comes to distinguishing people who have been vaccinated and others who have not within our own country, There are questions of fairness and justice that come into play. There could be discrimination, for example. I understand that we want to encourage and motivate everyone to become vaccinated. That's how we'll get through this. But we need to think of people who, for medical reasons, for example, or for other circumstances, cannot or do not want to be vaccinated. We also need to think of justice and fairness as we consider this question. That's something I've said since the beginning, but we're continuing these conversations.
It's obviously important to highlight that we want to encourage and motivate people to get vaccinated as quickly as possible. Getting as many people vaccinated as quickly as possible is the way to restore a semblance of normality in the coming months. And of course, we're going to make decisions step by step and look at all sorts of different ways, both to encourage people to get vaccinated and keep people safe. The idea of certificates of vaccination for international travel exist already and are well established. There are countries in the world where you shouldn't go unless you can prove that you've been vaccinated against certain tropical diseases, for example. That's well established. But the idea of certificates of vaccination for domestic use to decide, if who can go to a concert or who can go to a particular restaurant or engage in certain activities does bring in questions of equity, questions of fairness. There are some people who, because of medical conditions or other reasons, will not be able to get vaccinated. There are others who are not on priority lists who will have to wait much longer before getting vaccinations. These are things that we have to take into account so that, yes, we're looking to try and encourage everyone to get vaccinated as quickly as possible, but we're not discriminating and bringing in unfairness in the process at the same time.
En suivi, Marie?
Follow-up question, Marie? Yes, you just repeated the answer you gave this morning to CTV. What I want to know is if there's a risk of discrimination, why are you not excluding a domestic vaccination passport? When it comes to an election, however, you've said that you would like to be able to continue to manage this crisis until everyone's safe. I'm paraphrasing, of course. Are you now excluding any possibility of an election if everyone is not vaccinated, rather? What is your criterion to say that you've come through this crisis? Answer: I understand, Marie, that the opposition parties and parliamentary journalists have elections on their mind. I am not thinking of elections right now. My priority is COVID-19. It's this pandemic. It's rebuilding the economy as quickly as possible, as well as possible. That's what we're working on, and we'll continue to work on these issues.
Opérateur, prochaine question au téléphone.
Thank you. Merci. Next question, Charlie Pinkerton, iPolitics. Line open.
Good morning, Prime Minister. There was a story in the New York Times yesterday about tens of millions of doses of AstraZeneca's vaccine that's sitting in American facilities. And that's because the states themselves, they haven't approved the vaccines, so they're not being used. But the Biden administration won't approve their shipment to the European Union. Has your government reached out to the Biden administration about Canada being able to access these?
Over the past weeks and months, we have engaged with all different vaccine companies, with all of our allies to talk about getting more doses to Canadians as quickly as possible. Those conversations will be ongoing. We will continue to look to get as many Canadians vaccinated as quickly as possible so we can keep people safe and bring our economy roaring back. Those conversations will continue with everyone.
For weeks now, we've been in talks with the various vaccine companies and partners around the world with regard to our desire to vaccinate Canadians as quickly as possible so that our economy can be brought back to normal and people protected. These conversations will continue.
With respect, Prime Minister, you did not directly address the question. Have you spoken to the Biden administration or anyone in your government spoken to the Biden administration about freeing up these tens of millions of doses of AstraZeneca's vaccine that are sitting in American facilities?
Over the past number of months, we've had lots of great engagements with the American administration on COVID-19, on working together to keep people safe, on vaccinations, on border measures. Those conversations with the Americans will continue, as they do with all our partners.
In the last months, we've had many conversations, including direct conversations with, between me and President Biden on the need to vaccinate our citizens, on cooperation, and the need to continue to protect people through border measures. And we'll continue to have those discussions.
Opérateur, dernière question au téléphone avant de passer dans la salle.
Thank you. Merci. Prochaine question. Catherine Lévesque, La Presse canadienne. À vous.
Catherine Lévesque, La Presse Canadienne. Question. I'd like to come back to your meeting with the First Ministers of the provinces and territories yesterday. I'd like to know if they have, I know that they asked for a $28 billion health transfer. What did you answer to them? Answer. We continue to have very good meetings with the First Ministers of provinces and territories, first of all. This was our 28th meeting, and I can tell you that we had a very positive conversation. It was obviously focused on this unfortunate anniversary, the one-year anniversary since the beginning of the pandemic, and the work that we are all doing together to ensure that in the weeks to come, Canadians will receive the support and the vaccines that they need to get through this. We spoke of various vaccine procedures, how to increase the average, how to increasing the number of vaccines arriving. And I told them that we are here to support the provinces and territories, as we are also here to support the citizens, Canadians, and have been since the beginning of this pandemic. As for health funding questions, we are going to continue to be supporting the provinces and territories. As for the long term and our healthcare system, we will be having these discussions once we get through this temporary crisis. I recognize that we need to increase healthcare transfers in the long term, but we've sent a great deal of money and funding already to the provinces, and we want to ensure that people can get through this pandemic. Follow-up question? I understand then that the question was discussed, if I read between the lines. Why is it that we still don't have a date for the budget? Why are you waiting until April before releasing a financial statement, economic statement? Don't you think Canadians would like to know more? Answer. Since the very beginning of this pandemic, we've been very transparent with regard to the investments we are making to support families, workers, provinces, territories. We are going to continue to do so. We'll be open about the fact that we're here to support Canadians. We'll provide what is needed for as long as needed, as is needed. That's the promise we've made to Canadians, and we'll reveal the budget date in the weeks to come. But Canadians can be confident that our approach is to be here for them, to invest in communities, and to ensure that Canadians succeed and are safe. This is not every political party's opinion. The Conservative Party is saying that we're doing too much, too quickly. These will surely be conversations that we'll have again when it comes to the budget. But we have had good news with regard to the economic recovery, and that's related to the investments that we've made to ensure that Canadians can get through this crisis in the right way. We'll go to questions in the room now.
Mr. Trudeau, my name is Mal Hamidian with the Canadian Press. You have talked repeatedly over the last half year or so about building back better. And you have also you had actually to repeatedly hold off on bigger picture plans in favor of extending measures, temporary measures and programs to help Canadians through the pandemic. What economic or other markers are you looking for in switching from crisis response to bigger picture recovery?
Well, I think everyone knows that we have to get through this pandemic. We have to make sure that Canadians are safe. That is the top priority of this government, and that will continue to be the top priority of this government. At the same time, we recognize that one of the best ways of ensuring that our economy comes back strongly, comes roaring back as we get through this pandemic, is to make sure we're giving Canadians the right supports throughout this pandemic. That's why we made a simple promise. We'd be there for people as long as it took, as much as it takes. And that's what we're going to stick with.
Next question in the room.
Mr. Trudeau, Chris Nashkite, CTV National News. President Joe Biden last night said Americans are going to be able to have a July 4th barbecue because every American will have their shot by then, a somewhat return back to normal. When are you going to formally change your vaccination timeline for Canadians?
The big vaccination timeline that we have been talking about for a long time now has always been the end of March. And we had a goal of vaccinating or getting 6 million doses into Canada by the end of March. We're now looking at over 8 million doses by the end of March. So that is good news. We have also made repeated commitments to Canadians that everyone who wants to get vaccinated will be vaccinated by September. That continues. But in my conversation with the provinces last night, we heard from a number of people who are looking to have everyone received a first dose earlier than that. We will continue to work with experts, work with the various provinces, and do everything we can to get everyone vaccinated as quickly as possible so we can get back to normalcy as soon as possible.
Answer repeated in English. We've always spoken of two specific targets when it comes to vaccines. First of all, we talked about receiving 6 million doses by the end of March. We're already speaking of 8 million now that will arrive in Canada before the end of this month. The other target was to ensure that every single Canadian could be vaccinated by the end of September. We are right on schedule. I can say that I spoke to the different provinces and territories yesterday, the premiers, and they hope to vaccinate as many people as possible with at least a first dose by May. We hope that we'll have good news in the months to come, better news. But we are doing everything we can to vaccinate as many people as possible, as quickly as possible, to get back to normal as soon as we can.
Prochaine question.
CBC. When Donald Trump even threatened to block PPE, there was an uproar in this country. And now you've got the Biden administration actually blocking shipments of vaccines. What do you think about that action by the Biden administration? And are you worried that this kind of response from the United States is going to threaten Canada's shipments of AstraZeneca vaccine?
None of the vaccines that we have been contracted for or promised to Canadians have been blocked either by the European Union or by the United States. We have signed significant contracts for tens of millions of doses that will be arriving in the coming months. And we are confident that there will not be interruptions to those vaccines. But it's one of the reasons why we have signed a more diverse portfolio than just about any other country for more potential doses per Canadian than for any other citizens in the world, because we knew that there was always a potential of challenges around that. That's how we make sure that we're going to be able to vaccinate as many Canadians as possible, as quickly as possible. On AstraZeneca, we have a contract for about 20 million doses this year, and we are looking forward to receiving a schedule on those doses, hopefully in the coming weeks. We will continue to work to get as many doses as possible, as quickly as possible for Canadians.
Answer repeated in English. Since the very beginning, in French rather, since the very beginning, we've signed various contracts with various companies to ensure that our supply chain is resilient to ensure that if ever there were any challenges, delays, or even products not coming through anywhere, then we would be able to continue to provide vaccines to Canadians. And I can emphasize that no vaccine shipment was blocked by the European Union, by the US, or any other country. We are going to continue to receive the vaccines that we've ordered, and I can reassure Canadians in that respect. I should also emphasize that we have a contract with AstraZeneca to receive 20 million doses this year. We hope to begin receiving them very soon. Of course, we are waiting to see what their delivery schedule is. Louis Blouin, Radio-Canada, question. You said 3 years ago you were not aware of the allegations against General Vance. What do you say to Canadians who say, how is it that the number one of the Army, of the defense staff, could be facing allegations and the Prime Minister not be aware of this? Did your defense minister not have the moral obligation to tell you this? Are you not aware of information that's that delicate? Answer. It's extremely important for me, as you are well aware, that anyone serving in our armed forces or in the public service or anywhere in Canada has a safe and healthy workplace, as well as the means to lodge a complaint and be heard if ever they face harassment or bullying. That has always been very important for me, and our government has taken this very seriously as well. We've put measures in place to enable a change of culture, to provide the resources necessary for people who do come forward. But one thing that we did not do and what we shouldn't do is to give politicians the responsibility for investigating allegations. We need independent, rigorous processes instead. And that's exactly what happened in this situation. Minister Sajjan told the Ombudsman to provide evidence to independent bodies that would be able to do a rigorous follow-up. My office was aware that complaints had been made that were directed towards an independent body, investigative body, but there was no follow-up because the information was not provided.
I think everyone knows how important it is to me that women and men who serve in the Canadian Armed Forces, or anyone who works in the public service, or anyone who works in any workplace across the country, has a safe work environment and has the resources and the supports needed to come forward with any allegations of inappropriate or harmful behavior. That is something that we have taken significant steps on over the past number of years, but obviously there is much more to do, particularly given recent revelations about what's going on within the Canadian Armed Forces. The one thing that in all the different measures we've put forward to better respond to allegations and concerns is that we haven't given politicians themselves more tools to investigate allegations of malfeasance or wrongdoing. It's not for politicians to do that. It is for independent, rigorous authorities to follow up in the right way. And that's exactly what happened when the ombudsperson came forward to Minister Sajjan to highlight allegations that he had received about the Chief of Defence Staff. The Defence Minister, quite appropriately, said, I'm not the person who can investigate this. You need to go to the appropriate independent authorities who will follow up on this and take this very seriously. Our job as politicians is to make sure that these structures are there and that any allegations are taken seriously. This is what my office was aware of, that allegations were directed towards independent authorities. Now, it turns out that those independent authorities never received enough information to actually proceed with a full investigation, but that is something that is the right of people to come forward to who don't want to give more information. And we always have to walk that line very, very carefully, and as a government, we always have.
When we first broke the story on these allegations against General Vance, you and your office told us that you only learned of the allegations through our reporting. In fact, I think you may have said that in the House of Commons. But I think earlier this week or earlier on in the last few days, you yourself have since confirmed that your office did know 3 years ago of these misconduct allegations against Vance. So the first question is, why are we having such difficulty getting a straight answer on that issue? And then B, why 3 years ago? Why it seems like your office, somebody turned a blind eye essentially to these allegations.
On the contrary, David, 3 years ago, when the ombudsperson came forward to the minister and said, I have received allegations against the Chief of Defence Staff, the minister, quite rightly, directed the ombudsperson to the independent authorities who could follow up and create that investigation. My office was aware that there had been allegations that were directed to the independent authorities. The substance of those allegations, the details of those allegations were not known by my office. Now, 3 years later, as these events come forward with details of what those allegations are, I and my office learned about them through the reporting and the questions posed by the reporters at Global News. Il y a 3 ans, quand
Answer repeated in French. 3 years ago, when the Ombudsman met with the Minister of Defense to say that there were allegations against the Chief of Defense Staff, the Minister quite appropriately and correctly said, you must take this information to an independent authority that has the authority to investigate these allegations. We were aware that these allegations had been referred to an independent authority, but we did not know the nature of these allegations. And given that these independent authorities could not follow up on the accusations because there was not enough information, the issue was not revisited. There was no investigative process because there couldn't be one. And so a few months ago, when Global News managed to obtain more information on these allegations, I learned of it for the first time, and that is how things unfolded.
Good afternoon, Marika Walsh with the Globe and Mail. Prime Minister, you keep saying in your responses to this that the minister and your government directed these allegations to the independent authorities, but the Privy Council office does not have oversight over the military. So why do you keep saying they were the correct body to send this to when they don't have oversight over them?
Governor and council appointments like the Chief of Defence Staff have a line of responsibility that goes through the public service and indeed through the Privy Council office. We've seen a lot of discussions now about the appropriate investigative bodies either within the military or independent from the military, and these are all things that we're looking at very carefully in order to make sure that there are stronger processes in place to make sure that anyone who comes forward with allegations or concerns about misconduct of any type is properly heard, properly supported, and that we create a shift in the culture to make sure that these incidents aren't happening in the first place. And we have taken many, many steps since 2015, Marika, on delivering strengthened processes, better procedures in place. But obviously, there is more we need to do, and we will continue to do more. Évidemment,
Answer repeated in French. Obviously, despite everything we've done since 2015 to increase resources and the means to follow up on complaints or concerns that people may have, we obviously need to do more, and we will do more. Thank you, Prime Minister. That's all the time you have with us today.
Well, All right, that is the Prime Minister of Canada. He is leaving this briefing. Ministers and public health officials will stay, but we'll just dip away for a moment to assess what we heard. Probably the most interesting statistic that I heard came from Dr. Theresa Tam, who said about 600,000 doses of vaccine have been administered this week. That's the highest number so far. So there's a reason why you're hearing anecdotally more people getting appointments, because it's actually happening. Let me bring in David Cochrane and Catherine Cullen. What should we start on? Let's start on where he ended, and that was ongoing questions around what the Prime Minister and the Prime Minister's office knew about these concerns, allegations 3 years ago against former Chief of the Defence Staff Jonathan Vance. I'm not sure I heard much new there, Catherine, in terms of the Prime Minister's reasoning for why he didn't know more.
Yeah, I mean, he has gone a little bit further in depth over the course of the last week or so, Rosemary, and we have to say that is in response to an incredible amount of pressure on this particular story as the scope of the allegations against various members of the military continue. But obviously, that one central story about the Chief of the Defence Staff, now former Chief of the Defence Staff, Jonathan Vance, is one in particular that sticks to the Prime Minister because of the implications for his office. I would note that while he is trying to delineate between my office knew, an allegation was brought forward. We sent it to the appropriate authorities. One thing that he has not been explicit about and continued to not be explicit about today was when he was informed of this. The insinuation, I think, in the way that he is talking is that he only became aware that there was an allegation. Certainly that's how I understand what he's saying through the reporting, but he has not clearly said that, and he has been asked time and time again. And I think the questions about this issue more broadly, obviously they are going to continue. The Prime Minister likes to say, we've done a lot of work, but we obviously need to do more. He was more explicit on Tuesday, in fact, when he talked about the variety of institutions in this country that are failing people who are victims of harassment and sexual abuse, and just their, the job is just not being done well enough. But there are some much more pointed questions for the Prime Minister himself and the people around him about how this was handled.
Yeah, and the Minister of National Defence, should say,
Indeed.
is returning to a committee today to take more questions about how he handled it and why he handed it off to PCO and then didn't seem to follow up because didn't want to get involved in the process. David, your thoughts on that?
Yeah, I found the answers from the Prime Minister today on that to be quite maddening, quite honestly. He says he wasn't aware of a specific allegation against General Vance until the Global News reporting. Then reporting comes out that his office was aware of something 3 years ago. He's now saying his office was broadly aware, but not aware of the specifics, without answering whether he, the Prime Minister of Canada, was broadly aware of allegations against the Chief of Defence Staff. This is the repeat of the mistakes in the communication strategy we keep seeing from this government, where they can't just lay out exactly what they knew in clear language and clear timelines and clear English to move past something. So the next time he's out, he will be asked yet again more questions about this. And I understand they're playing some defense here because they want to protect their Defense Minister, Harjit Sajjan, of not doing any wrongdoing in his handling of this entire thing. But the drip, drip, drip of timeline confirmation and details and language evolution, it sort of creates an impression of not wanting to be clear, of hiding something, and not just laying your answers out for the country to understand it. So next week, we'll have to ask the Prime Minister if he was aware broadly 3 years ago of an allegation, or was it truly when Global News did this story? So it's kind of frustrating because you don't know what to say the Prime Minister's office actually knew when you're talking about this. And it just, from their own perspective, it just keeps perpetuating a cycle of questions and revelation where they could just get it all out of the way by laying out a straight answer.
Yeah, and it's not a topic matter that I think the government wants to be perceived as vacillating around, given it fundamentally is about sexual misconduct in the military and how it was handled and how it will be handled going forward. Okay, let's do vaccines also quickly. He touched on the deliveries that are still to come and the ramp up, and also on travel, which was sort of interesting. And we've heard Patty Hajdu certainly on my program, talk a little bit about those conversations as well. Catherine.
Yes. So a couple of things there, Rosemary. Maybe let's pick up the idea of these vaccine passports. Perhaps another instance during this news conference where you could see a little bit of reporter frustration in not getting a clear answer. He delineated between international travel documents. Anybody who has been to, for instance, certain parts of Africa knows you have to have a yellow fever vaccination certificate. That is something that is sort of more commonplace. But questions about vaccine passports to do things like, let's say, attend a concert, things like that. He suggested, there are some real challenges around those documents being discriminatory. If you're somebody, for instance, who just simply can't get a vaccine, that there are a lot of concerns, but he certainly didn't rule out the possibility explicitly that such things could exist in Canada. And we know that there are some jurisdictions like Quebec, for instance, where they've talked broadly about the possibility of something like that. I would also note, I thought it was quite interesting what he said about Johnson & Johnson. He said that he was confident there will not be interruptions. I would contrast that with what he said on Tuesday. We have heard in many conversations with Johnson & Johnson that there are challenges around the production of the Janssen vaccine, but we will continue to engage with them and we look forward to receiving doses as soon as possible. It's important to note, and I think the Prime Minister actually did touch on this, we don't have a delivery schedule for that particular vaccine, so I suppose it is more difficult to interrupt something without a specific delivery schedule, but he himself has emphasized that they have had conversations with the company indicating that the challenges are potentially there. And I think it's certainly something, as we see this issue playing out globally, for Canadians to be mindful of. All of that, again, as you said, happening at the same time as we see a greater number of vaccines this week. 600,000, Theresa Tam said. The Prime Minister himself highlighting we're going to be getting more than 1 million doses of Pfizer in no time. So we are ramping up while keeping an eye on some of the complications that are in the medium term, I think, for Canada.
And David, maybe I'll just get you to touch on AstraZeneca, because it was asked questions about that large amount that the president seems to be keeping keeping for the Americans for now, and whether there'd been conversations around that.
Yeah, and there is that question, as Catherine raises, of interruptions versus, say, delays, right?
Sure.
Like maybe it won't be interrupted once it starts flowing, but maybe that flow isn't until June, as opposed to April. So there's those questions. So a bit of a bad news, mixed news, or good news, mixed news on vaccines. Look, the million a week from Pfizer starting in April, on top of 1.8 million expected to be delivered in April from Moderna, and then 1 million from Covishield, means in April alone, the country is going to get almost 8 million doses, which is the total amount Canada has received from December until the end of March, based on anticipated delivery. So you're seeing the ramp up there. There are huge questions about AstraZeneca. The U.S. is kind of stockpiling tens of millions of doses because Joe Biden has made a big promise to do 100 million people in 100 million in the first 100 days, and also to have things kind of back to normal by July 4th in the United States. So AstraZeneca is stockpiling to be ready for U.S. approval to release it to the states and the health authorities there, so they can make progress towards that goal. It creates potential complications for us. Canada's supposed to start receiving AstraZeneca starting April 1. The U.S. Supply problems, the U.S. restrictions are a factor there. And also in Europe, AstraZeneca has told the European Union it's going to miss targets between April and June on delivery by more than 50%. And the European Union has made it clear, if you're not reaching our targets, we're not letting you export from here to other places. And that's a potential complication for Canada, because we're counting on Europe or the U.S. to get the AstraZeneca supply. And right now, those are kind of fraught with potential complications. The good news is there is enough doses coming from AstraZeneca from India and South Korea, and Pfizer and Moderna from Europe, where they're not having any problems, to give everyone at least one shot by Canada Day and vaccinate the country by September. So those broad macro timelines are not affected in a negative way by these potential complications, but they could be accelerated if Johnson & Johnson and AstraZeneneca can get going quickly.
Right, and probably why the government for now is not changing those broad, those general timelines for now. Okay, thank you both very much.
You got it.
I'll let you go. Catherine Cullen's guest hosting Power and Politics today, and David Cochrane is doing what he does. Thank you both very much. Okay, I'm going to leave things there and turn our coverage back to CBC News Network, and they can continue bringing you some of that press conference. The Minister of Procurement, Anita Anand, now speaking. I'm Rosemary Barton. News Network continues right now.
To the end of September. Thank you.
Thank you. We'll now go to the next question in the room.
There's Marika Walsh with the Globe and Mail. Minister Haidu, I'm wondering if you can tell us when you first learned there were allegations against the former Chief of Defense Staff, Jonathan Vance. Was it in 2018 as well, or was it more recently? And if so, when?